Yes, tinnitus is one of the symptoms that's really interesting because sometimes it's so unpredictable. Before we even do treatment, we have to diagnose it. But we have to look at patient with something called CBCT scan. So then we'll go ahead and do a lot of other tests, for example, nerve tests to see what causes the problem, where is the pain, and we can come up with a diagnosis that, oh yeah, there's definitely some kind of TMJ issues. If you have tinnitus and you have TMJ issues, you get TMJ treatments done, tinnitus will get resolved significantly because of that.
Dr. Chris Chui is a leading dental expert specializing in dental sleep medicine and TMJ disorders with a unique focus on how these issues relate to tinnitus, ear ringing. And as one of the few dentists double board certified by the American Board of Dental Sleep Medicine and the American Sleep and Breathing Academy, Dr. Chui brings exceptional expertise to the treatment of TMJ. And today we're going to dive into how many forms of tinnitus are actually linked to problems with the jaw or TMJ. Dr. Chui, I called you into this podcast because you have an expertise in TMJ, the temporomandibular joint. And what we've discovered is that there's a lot of undiagnosed issues with that area of the head, the jaw, and how that can lead to tinnitus or ear ringing for many patients. So, could you give an overview of what you see in your clinic with this problem?
Okay, that's a really good question. So a lot of times we talk about TMJ. It should be called TMD. TMJ stands for temporomandibular joint, but everybody has a joint. We just call it TMD, which is temporomandibular disorders, or TMJD, temporomandibular joint disorders. It's usually just a group of muscles connecting to the jaw joint with different movement. For example, you open your jaw, closing your jaw, chewing and yawning, and even you clenching the jaw really hard to lift dumbbells or exercise or lift something really heavy. But then there are a lot of sometimes because of the different sides of the muscles acting differently, the body's different. Sometimes you will have imbalance of the joint load on one side more than the other side. So when you open and close, it's the maxilla, which is the top part of the skull, and lower is called mandible. You open and close and grind the teeth together, and that will activate different muscles. In return, one of the really important nerves that connects to TMJ will also activate different muscles. So basically, it's a neuromuscular concept that when you grind the teeth, that's muscles, that's joint, that's nerve. The nerve can activate different muscles. And when the jaw is not in a good position, some of the muscles not going to be happy. And that's why patients have headaches and migraines and neck and jaw pain. But there are two really important muscles that one muscles will pull the eardrum and the other muscles will close the eustachian tube opening, which control the pressure between the middle ears and the throat. So these two muscles working together when you clench your jaw and have all these TMJ issues, it also got activated. That's why people will hear sounds with the even middle ears with something like pounding on the ears. We hear all these sounds coming from it because the muscles pulling the eardrum coming from the same area that the nerve innervate all these muscles around the TMJ. So that's a very strong correlations between TMJ issues and also tinnitus. And a lot of people would not look at that because this is something that's really, a lot of people, they don't really feel like, oh, when I have tinnitus, I look at the teeth or the jaw, the bite, but I have a lot of other symptoms like headaches, migraine, and jaw pain, but they don't know this actually correlate together. So something's really good that we actually work together because tinnitus is such a huge problem that people do not fully understand it. However, we all have different treating methods, but we all have to work together because multiple things work together because you can help with the multifactorial issues coming from the TMJ that can also cause the tinnitus that will be treated a lot better with different people looking at it differently.
So if you'd like to schedule a free consultation to explore which tinnitus treatment is right for you, click the link right there to book a free call today. And my team will take care of all the next steps to help you. So do you think that we're missing a jaw diagnosis for many patients who have tinnitus or ear fullness? What are your thoughts on that?
Yeah, but I'm not saying everybody has tinnitus will have TMJs, but about 40 to 50% of TMJ disorders, according to research, that patient will have tinnitus. Tinnitus might not show up immediately, but something show up a little bit later. So when you have some muscle problems, you'd be grinding on the teeth, the jaw pain, headaches, and slowly you'll get more and more. And sometimes it's correlated to something that's coming from the central nervous system that, oh, something is wrong. I just need to move my jaw differently because the jaw may be retruded to the back and hitting the nerves more. closer to the ears, and the brain tells you, oh, I need to move around the area. That's the same thing also happening when you sleep, because when the jaw is protruded, activate the muscles extraorally and intraorally, the airway is also smaller. So a lot of patients with TMJ issues, they also have sleep apnea issues. They have tinnitus issues. So there is a mixture of everything, but they are not happening at the same time, at the same place, but they can oftentimes will include one or the other. But a lot of times we do not look at them as a whole, and that's why people oftentimes would not get down. However, if you have tinnitus and you have TMJ issues, you get TMJ treatments done, tinnitus will get resolved significantly because of that.
I love to hear that. How we got connected was that at Treble Health, our team started to really focus on what is the root cause of the patient's tinnitus. And one of the three factors, with the three primary factors for tinnitus, is somatosensory issues. That typically
Mm-hmm.
has us look at the jaw or the neck. So we got connected because we realized that some of our patients need to be evaluated for issues related to the jaw,
Mm-hmm.
and your center and your work does an excellent job at this. So since then, we've gotten some advice from you on what types of symptoms may suggest jaw issues related to tinnitus. For someone who's listening who definitely has tinnitus, can you give some tips on, in your experience, what types of tinnitus, the sound quality, is it one ear or both ears? Does it come immediately? Does it come slowly? What are you seeing in terms of the symptoms that would suggest an evaluation to rule out jaw problems related to tinnitus?
Yeah, a lot of times tinnitus can happen in different times. Some people say, oh, it just happens sporadically. However, sometimes I always recommend my patients to really, really remember, really to put down everything that you experience on a daily basis, and whether you're not on your phone, on a smartphone, and put it down. Hey, what happened that day? Did you have a really, really heavy meal? Were you under a lot of stress? Did it happen in the morning? Did it happen at night? So what happened before that? If you realize you're under a lot of stress and the jaw's hurting and then the sounds get worse, and most of the times for TMJ usually happens more on the side that have more problem with the TMJ issues. And you talk about the somatosensory coming for the tinnitus. It's actually coming from the somatosensory, how you feel the surrounding. You're coming out from the other side, which is the motor outcome, which is controlling the muscles. So sometimes stress causes motor neurons to activate muscles clenching and grinding. Headaches and migraine, all coming from muscles. Pulling the eardrums coming from muscles. So whatever causes a sensory input, for example, stress, you're eating something really hard, and brain says, oh, something's not good, and then you just feel the pain and you clench yourself even harder, and then that's caused the issues. So you really have to kind of find out what's caused it. But tinnitus can come from many, many different factors. But if you find out this is coming from your jaw, pain, coming from grinding, stress, and all these things will get worse, very, very, very highly likely it's coming from the joint that innervates the nerves that also innervate the ears. And that's something that we always recommend patients to at least get a consultation with some specialist looking at the TMJ together.
So let's go over some potential common cases. Perhaps someone develops rather sudden tinnitus in one ear and they have some jaw pain or some history of teeth grinding. Let's just go through perhaps the most common case that you would see in your
Sure.
clinic where someone has significant
Yeah.
tinnitus and significant
Sure.
jaw issues.
Awesome. So the most common symptoms of TMJ we see on a daily basis, primarily the jaw pain. You could be coming from the pain. You can point the joint, the pain where it's coming from. It could also be the joint or the muscles. You always have to ask the patients where the origin of the pain is. Some patients are coming with the jaw locked. Like jaw locking is make it very difficult for you to open or close your mouth. And a lot of people will hear the clicking and popping of the jaw joints when open and close. Patient will feel the ears having some kind of aching pain around the ear stuffiness, or raining the ears coming from the area. That can be also that's something that we are already talking about. Headaches, chronic headaches can cause a lot of crippling, migraine, and things like this. Sometimes it will happen a lot more on one side with the same side of the tinnitus. And facial pain with it's like an aching pain around the facial, perching behind the eyeballs. Sometimes can radiate to the back of the neck and shoulders, and also to all the way down to the upper back and slowly going down to the lower back. Some people might experience the limited jaw movement. Like open a little bit, cannot open all the way. The jaw is stuck. It can only open partially. And some people would clench and grind their teeth a lot more than other people. For example, you in the night guard, the dentist telling you, but night guard might not be the choice for some patients when you have this problem, but we find it often, but there's sometimes that we will be able to come back and talk a little bit more. But neck and shoulder pains a lot of times can come back to the joint because the nerve coming from the joint can affect the posture, and the posture will affect the nerve leading to the neck and shoulders. Some people have the middle ears issues. They feel a little bit dizzy and they move around a little bit. They start feeling dizziness and coming from the joint. In return, they have problems balancing themselves. And I think this is just the brief summary of what usually we'll see in the office for patients who have typical TMJ issues.
So, for anyone who's listening, if they have some of these symptoms, it may suggest that they get an evaluation. You've told me previously that there are some centers like yours that are very specialized in this and have a comprehensive approach, but
Yes.
many local areas may not have access to this. So, what's your
Mhm.
advice for those listening who are listening from all over the world and all over the United States of where should they go to get a proper evaluation of their jaw to consider is part of their tinnitus caused by TMJ?
Yeah, it's kind of hard because a lot of time this specialties is not really fully understood by many different providers. You might be able to start with because a lot of areas in the country you don't have this kind of specialist to help you to diagnose with the symptoms together. But one thing I think you can really go and look into are the university-based hospitals or dental schools that have TMJ centers that you can go in and ask them and have them evaluate. Most of the time, the hospital-based dental schools, they also have audiology clinics. So they most oftentimes will work together. I think that would be a really, really good start to see. But a lot of times, however, even between hospital and dental schools, and they may not talk closely among each other. So patient has to be a little bit more proactive to kind of go in and find the connection on yourself. Say, hey, can I see a dentist who specializes in TMJ to understand tinnitus? And audiologists will go in and to do some research for you. And also the patient can go ahead and ask the dentist, anybody who knows this, and do you know any audiologists that can help you with this situation, then understand TMJ as well. So it's sometimes it can be hit and miss. However, I think if you really, really dive into it, you should be able to find some kind of connections there too.
Absolutely. There are telehealth services, Treble Health as well. I believe SF Dental
Mm-hmm.
Wellness does some telehealth evaluations. So that's an extra resource for patients as well, either to get a second opinion or to review some test results.
Mm-hmm.
But let's go back to that average person who wants to rule out TMJ. They go to this
Mm-hmm.
specialist. What would be the standard treatment approach for most cases of TMJ?
Well, when you do treatment, before you even do treatment, you have to diagnose it. But we have to look at patient with something called CBCT scan, which is a cone beam CT scan. It's not a medical CT. The radiation the dosage is a lot less. It's a little bit more dosage than full X-rays. So for the CT scan, we can see a 3D image of the jaw. Sometimes we can even see the airway and the posture and the spine, any anomaly in the anatomy of the joints, and how your teeth going back together, and also look at the symmetry with the rendering view of the scan. So then we'll go ahead and do a lot of other tests, for example, nerve tests to see what causes the problem, where is the pain, and we can come up with a diagnosis that, oh yeah, there's definitely some kind of TMJ issues that cause all these problems because of the testing that we test on the patients. And most importantly, we always look at the medical history thoroughly and ask tons and tons of questions with the history coming along. When did it start? What happened? Who did you see? Whatever you do, did you get better or get worse? Because a lot of times things get lost in a way that those are really good, important pieces of information. They have to put them together. So once the patient get diagnosed with TMJ issues, we can start treating the patient. The most important part that we know that is the pains are coming from the muscles. When muscles activate in the wrong way, the body's going to torque differently coming from the jaw joint. So teeth are the huge factor involved. If the bite is not in a good position, every time you bite down, you're going to torque different muscles. So one thing we know that when the muscles are not happy, joints not going to be happy, pain's going to happen, just go through everywhere in the body. So one thing we really have to know is to calm down the nerve and relax the muscles. However, we ask the patient to relax. Nobody knows how to relax your jaw. And even I look around and you cannot really do some measurement with the jaw and hey, this is your muscles that's relaxed. So we use something called TENS unit. It's called transcutaneous electrical nerve stimulation unit that would target 3 cranial nerves with all the muscles, every piece of muscle above the clavicle will get tense up for about 45 minutes to an hour. The jaw is going to get really, really relaxed, and then the jaw is going to go to position where all the muscles are relaxed around the head and neck area, primarily around the joint area. Most likely, the jaw will go down forward and downward and forward to alleviate the pressure so the condyle will not squeeze against the nerve ending around the joints. And the reality is when all these muscles are relaxed, the patient's posture will change and the spine will line up a lot more because there's no longer torquing coming from the jaw joint when you bite down. So the bite will open up, and then with a much more relaxed position, then we'll capture the bite with the teeth with a really specialized intraoral scan, and then we will fabricate a lower, what we call neuromuscular orthotic. And the patients, once they put it in the mouth, for example, there's some discrepancies of the jaw joint. Every time you open and close, instead of doing this, you can only do that. So you will not torquing the jaw. Mandible is the one that causes all the issues and hitting directly onto the jaw joint and activating more different muscles. But when you open and close, everything is symmetrical, is comfortable, and balanced and relaxed. Everything else is going to balance it on its own. So the bite will open up to the really relaxed position. And on top of that, we will make the muscles even more relaxed using laser. There's some type of laser we're targeting on the neck and shoulders. Primarily will reduce inflammation, reduce pain, and initiate healing immediately. Specifically, when patients have tinnitus, we have a specific tip, go to the ear canals, and kind of shine the light around the muscles that pull in the eardrum and the eustachian tube to relax that. It's extremely, extremely effective. So if it's coming from those muscles pulling the eardrum when the muscles relax, patient oftentimes will get a pretty good relief of tinnitus. On top of that, when the jaw is no longer biting down to the position to activate those muscles again when you're wearing the orthotic, and things start to change, the posture change. Posture and bite will go hand in hand. So that's why we have patients to come back again, and again. Slowly the posture change, but then we have to adjust the bite to make sure every single part of the teeth are touching simultaneously. So you no longer will be torquing the wrong muscles. And that's how we control the bite and make the jaw joint feel a lot better, get rid of the symptoms to prevent it from getting worse over time. The most important part is because a patient come and see us, they already have a lot of arthritic changes in the jaw joint, so a lot of bony changes, remodeling around the joints. And they might not even have the disc involved. So there's another really, really great technology nowadays. We use something called platelet-rich fibrin. Basically, you take out the blood from you and spin it with the blood. We get the best part of the blood, which is the platelet. It has a really, really multiple properties inside those platelets. Is anti-inflammatory, anti-pain, and also some growth factors. So you help the joint to remodel back in certain ways. So instead of have some active resorptions, hopefully the resorption will go away and your body will stop damaging the jaw joint on its own, and then there's no trauma on that. And hopefully there's some ligaments or some soft tissue left over can slowly grow and produce a pseudo disc for long term, prevent the impact again from the teeth onto the jaw joint. Some patients will have some posture issues. We'll do some trigger point injection on the neck and shoulders. So we alleviate a lot of symptoms immediately. But the most important part, we usually work closely is with other professionals. We refer a lot of patients to Treble Health for you guys, tinnitus, because that really helps to reinforce the idea in patients on a regular basis, because a lot of confirmation will calm the patient down. Whatever you guys do, and when you calm the patient down, you give it the fight or flight responses, the patient will feel much better when someone else is actually on a regular basis talking to them. And also in the same time, might not be just coming from the jaw joint. We also oftentimes find out that a lot of problems coming from the back and lower back area. Instead of going downward problem, it's coming from the back. For example, patient has scoliosis, that we have to refer the patient to cervical chiropractors or physical therapists. And at the same time, we often feel that and see that patients have all these issues. Stress coming from it is because they cannot breathe through their nose. If you cannot breathe through your nose, you're breathing through your mouth. That causes a lot more stress, more grinding, more postural issues, more muscle activities. All these symptoms are going to come back together. because of that. And also we work closely with psychologists and psychiatrists to have the patient flowing back and forth. We have to make sure to work with psychiatrists because a lot of times these symptoms also mimic depression. Some patients have true depression. These symptoms will be alleviated a lot by the psychiatrist. However, we have to make sure TMJ pain and depressions, they all share a lot of similarities. So oftentimes the patient might be prescribed some antidepressants, and a lot of these antidepressants will come with a side effect, will increase the teeth grinding more. So we have to work closely with psychiatrists to make sure the dosage is right, and we have to slowly work with the patients. And the patient's symptoms get better, can we reduce the dosage of the antidepressant because of that? It really requires an overall wellness team as a team approach to treat all these together. One person cannot treat it all, and this is really important. And that's why I'm here to share this knowledge with you guys, because this is something that truly is really amazing, how people work together and treat some symptoms that one person cannot treat at all. It's really important that we all come in together and treat a patient, and the outcome of the result will be so much better because of that.
Completely agree. Well, I wanna highlight. You mentioned a few treatment options. So you mentioned the mouth guard, the orthotics. You mentioned the TENS unit, and then you mentioned the more advanced laser therapy. So for the average person who's listening who may need one of these treatments, what is the typical course for that patient? Would you start with a more basic approach and then go advanced from there? Or is it only specific centers around the country that do the whole comprehensive advanced approach? What do you normally see?
Yeah, a lot of patients, when they first started, they have some jaw discrepancies. When you have a little clicking and popping and some grinding issues, when we look at the jaw, that's not a lot of symptoms. We can just start with a night guard first. Regular night guards can allow the jaw to relax more. However, if someone has a jaw discrepancy, the night guard will have exactly the same thickness. It doesn't really change it. But when you have something between the teeth, you will alleviate some pressure behind the jaw joint. But if symptoms get worse or it did not help, it doesn't help. Even some patients, they say the night guard hurts him or her even more. So then that's time they have to look into it more carefully. Hey, what's really causing all these issues? Especially you have multiple things going on together, especially with tinnitus and headaches and migraines and back pain and lower back pain. So we'll slowly go into one of the really important pieces of information is coming from the CBCT scan. We want to see if there's any major changes in the bony structure. And the really important goal is, can we do something now to prevent a lot more problems in the future, namely surgery? A lot of patients will go through surgery at the end, but all these treatments that we're talking about is really try to prevent more long-term problems as a whole. And the orthotic that you wear, as long as you wear this, all the muscles will relax. And as time goes by, you might not have to wear it all the time, but the orthotic, when you go to sleep, you're a lot more calm. And if you try to grind your teeth because of stress, you cannot stop stress in your life. It's how you can tackle the stress. And when all the muscles relax, even though we try to clench, and it will get a lot less trauma onto the jaw joint. And that's what's really important. It's really hard to handpick what first and second, but if something's going on, you really have to really look deep down inside and kind of see everything and really treat everything as a whole. That's how we treat the patient.
All right. So my question is, with this kind of treatment, how much time do you need to see the results? Do things get better? Does tinnitus reduce in a matter of days, weeks, months? What do you normally see?
Yes, tinnitus is one of the symptoms that's really interesting, because sometimes it's so unpredictable. Some people will start seeing the result immediately. Some people it takes longer, but tinnitus is the symptoms mostly come with TMJ issues. They might come much more in the later stage of the TMJ side. If it's truly coming from TMJ, and usually the last one to go, and all of a sudden it just goes away. A lot of the time, this has to deal with inflammation, because the muscles are pulling the eardrum compared to the masseters or temporalis is a lot bigger, and that's we can target a lot better. So it's also deep inside into the skull. However, when everything slowly calms down, then that's when everything just start to happen. Most of the time, we treat patients for about 3 months. And it's about 12 weeks. Every week, patient will come in, we'll do the laser, and we'll check it with tensing. And very importantly, along the way, we have to accommodate the bite, because the muscles start to change to get more relaxed. You have to accommodate that, because the bite will change. We have to adjust it. When the bite adjusts, you no longer clench harder. So it's balanced, patient feel better, the jaw got relax a little bit more, you go to different positions. That's why it's a very tedious process, but everything comes back from it is when patients getting more and more calm and more relaxed coming from them. So really, really depends on how tight the muscles are and how fast the patient can relax more. The longer the patient is under stress, the more inflamed the muscles actually takes longer. Most of the time, after 12 weeks, we can see a huge improvement. But sometimes along the way, patient might also, well, I still feel some of the tinnitus, but 3 months later, also they would just tell us, oh, it's gone now. So all these are, as long as you wear the orthotic, just let it sit there and simmer it and relax and get rid of the inflammation slowly, the patient will get better and better over time. But majority of our patients, 3 months is a treatment period that we will see most of the results get better.
Excellent. Love to hear that. And I know that you spend a lot of time working with veterans. Veterans often have hearing loss and tinnitus related to the cochlear subtype or root cause of
Correct.
tinnitus. So
Mm-hmm.
it must be a little complicated sometimes to say,
Oh yeah.
oh, well, you have tinnitus on this one ear, but you also have asymmetrical hearing loss worse on that side. You've
Mm-hmm.
had hearing loss for 5 years. You've had
Mm-hmm.
TMJ for a few years,
Mm-hmm.
it seems, and you've had tinnitus for a while. So, any thoughts on the relationship between hearing loss, tinnitus,
Mm-hmm.
and TMJ?
Yeah, it's really, really interesting because as a clinical director at the Veterans San Francisco, it's really, really interesting how the whole thing started evolved because the VA actually set up this program and coming from a dental clinic and becomes really quite well known among the VA community because we become the central hub of the community among the VA, most especially on the West Coast. So we got patients flying in from Oregon or Hawaii or Arizona to treat it because a lot of times when we're looking at this now, people recognize this. It could be something that could be multifactorial. The beautiful thing is, as a VA, everybody is on the same platform. So I can talk to the psychiatrist, I can talk to the ENT, I can talk to the neurologist. Some of these issues can be also be coming because of central issues and could be a psychological problem for all this depression, especially PTSD, is huge among the veterans. And all these can cause us problems that we can increase more grinding and clenching. And they're true depressed. And with PTSD, with grinding and clenching, and also along together, you have patients who snores more and with more sleep issues, sleep apnea, and sometimes they may have injuries. So this cannot say, oh, one person can treat everything. So it has to be a team approach. And a lot of times I can do something, help, and along the way, the other person can do something else. Even the therapy will help the patient and help them to calm down. So the patient will calm down the autonomic nervous system, the term that usually explain to the patient, you are no longer what we always talk about fight or flight. You don't fight. If you don't fight, a lot of symptoms will get better. So, I mean, we oftentimes will talk to many different physicians and different providers and come up with the treatments together. And that's really, really even important. And coming out of VA, we are private practice. We have a very strong network with many people around us. And if I don't know something, the other person will help us with the answer. We'll talk to a chiropractor, physical therapist, and psychiatrist, ENT. I mean, everybody's on the same page, and we'll have oftentimes we have study group, and together we'll go over cases. And I think that's really, really important. That I just love the idea of people actually sit down and share the information together.
I want to highlight that many people with tinnitus are experiencing anxiety, fear. You know, they have these automatic negative thoughts like, I'm never going to get better. This is going to, make me lose my hearing.
Mm-hmm.
And, my life is in jeopardy here. They may hear this talk and think, oh my God, my doctor's missed TMJ. That's the reason I have tinnitus. But I don't want people here to develop more anxiety hearing this talk. I want them to feel better and have, open a door, so to speak, of
Sure.
maybe
Mm-hmm.
there's this path that could lead to relief, but not necessarily guaranteed to do so. Any advice here for those listening on a way for them to estimate, I wonder what percentage of my tinnitus could be related to TMJ. I
Mm-hmm.
wonder how important it is for me to pursue this path now that I
Mm-hmm.
know it's a possibility.
It's really, really simple. You always, oftentimes, can kind of feel around your jaw. Do you have any pain around the jaw? Are you missing a lot of teeth? Can you chew function well? The function is good, and you can, for the veterans, they can always go back to the primary care provider to check the jaw joint, or if some of them they are eligible to go to dental clinics and check. Oh, do I have TMJs or not? Even in private practice, you can have their dentist check that for you. There are definitely many happy stories coming from treating to ENT, from ENT to audiologist to sleep to TMJ. I'm not saying this is something that can help everybody 100% for sure, but it never hurts to know there's an other treatments out there potentially can help you that a lot of other treatments in the whole world of medicine is not helping. Many of my patients come in, they already have the CT scan done, MRI, hearing tests, went through a bunch of neurologists, psychiatrists, and the symptoms getting worse and worse and worse over time. And we start looking at that's why I look at the medical history and start pointing in different parts in the jaw and the neck, and hey, everything hurts here, and have them bite down different positions to do the test, and immediately a lot of muscle feels better. Those are the prime patients that we can definitely treat immediately because the patient can feel everything feels so much better immediately. But again, there's many different things. If you have a lot of injuries in the past and something that we probably not even be able to help, for example, someone that went to the war and came back with injury on the ears, and that's nothing I can help you. But when you look at everything as a whole, a lot of times they will always provide additional hope and additional treatment options out there. That is not invasive. We don't like medications and we don't like surgery. And everything is just provide a vehicle for patients to rest on the jaw, to rebalance all the muscles back, and patient's central nervous system can come back and balance the autonomic nervous system and get control back. And then you can improve the digestion, you can improve your sleep, your hormones, and everything just because of the balancing of the jaw. You can actually go online and look at TMJ posture to see so many things there. This will change everything on your body, but if you can unlock it, the circulation of the body and how the central nervous system communicate to the rest of the body would be so much easier and better, and the patient will feel better and more calm. So you see this all the time.
Dr. Chui, thank you so much for sharing your information today. I want patients to know about your resources, where they can potentially
Mm-hmm.
find your work or go to your clinic. So, where can our listeners, where can people find you and potentially work with your team?
Yeah, you can actually Google San Francisco dental wellness. This is my passion. I don't think it's just dental, it's a wellness as a whole, as a health. And we are in the middle of expanding our shelf, and we are moving to different parts of the city. And because we're getting really busy for the past year or two. And we tentatively have the names called Bay Sleep, Bay Aesthetic Sleep, and TMJ. Some people actually that it can be an equivalent for best. So we call ourselves the best. It's called Base Aesthetics TMJ. But right now you can Google San Francisco's dental wellness. You can find it in the website, and then you can even schedule an appointment there directly with whether virtually or physically come to the office, and we'll do exams for you.
Excellent. And if you reach out to Dr. Chui's team, tell them you came from Treble Health. Dr. Chui,
Yes,
thanks so much and look forward to continuing to work alongside you and your team. Appreciate it.
perfect. Have a good day. Bye.
If you'd like to explore which tinnitus solution is right for you, book a free call with my team at Treble Health. We can meet over Zoom and discuss which option is the best fit for your treatment. Click the link on the screen right now, and we'll see you on the free call.